Good morning, viewers. I'm your host, John Harry, and today we're going to discuss a very important disease that is chest pain. Dear viewers, chest pain is common all over the world and it kills millions and millions of people around the globe every year. According to the data coming from America, it kills about 5 million people only in America, and it costs about 8 billion US dollar over there. Now, what causes chest pain? What are the signs and symptoms of the chest pain? How we can assess this problem, and how we can treat and manage this problem, and how we can prevent ourselves from this problem. For to answer these questions, we have invited Dr. Fancy in our studio. Dr. Fancy is a cardiologist and chest pain specialist, and she is working as an associate professor in Hunan Provincial People Hospital for almost last 10 years. Good morning, Dr. Fancy.
Good morning, Harry.
How are you today?
Fine, thank you.
Okay, Dr. Fancy, my first question is that as you heard that I've explained the data coming from America, that it kills about 5 million people only in America, and it costs about 8 billion US dollar over there. Now, what's this ratio in China?
Actually, more and more people suffer from chest pain recently in China. The main cause of chest pain is cardiovascular disease. About 3 million people die from cardiovascular disease every year in China.
Okay.
According to our data conducted by the government in 2007, the number of patients die from myocardial infarction is up to 2 billion. And the annual medical cost for cardiovascular disease has reached about 113 billion yuan.
Okay, now you mean that the 2 million people are killed and about 130 billion yuan is cost on this disease. Now it's a huge burden on the economy of China.
Yeah.
Now, Dr. Fancy, my question is then what kind of patients are regarded as a high risk? And why and how they should immediately rush to the hospital?
The chest cannot be the same signs for everyone.
Okay.
To clarify it, let me introduce the function of the heart and the coronary arteries. Our heart is like a pump, which pumps blood to the brain, on the surface of which is located coronary arteries. These 3 small vessels can supply the blood flow and carry oxygen to our heart.
Okay.
Once there is a stenosis or blockage in coronary arteries, then the heart may get damaged or die.
So you mean that on the surface of our heart there are coronary arteries, and when they're blocked, right, the patient suffer from the chest pain.
Yeah.
So what are the underlying causes or the risk factor for this problem?
The risk factors, there are many risk factors for such kind of cardiac disease.
Okay.
And the more risk factors you have, the higher risk you may suffer from chest pain.
Okay.
There are many risk factors just like age, family history, and hypertension, high cholesterol, smoking, drinking, obesity.
So you have talked about the high cholesterol, right?
Yeah.
Like high cholesterol means, as I know that high cholesterol means that a high lipid inside our blood, right?
Yeah.
Now, how we can control this high cholesterol level in our body?
This is very important. Nowadays people cannot eat very healthy.
Okay.
They can take food high in salt and high in fat.
Yeah, like young people nowadays, they like to eat KFC.
Yeah. And we always call that junk food.
Okay.
And you should eat more vegetables and fresh fruit. And otherwise you may become overweight. So the diet is so very important.
Okay. What do you think about the drinking and smoking, that nowadays a lot of young people are addicted to these things like smoking and drinking? What do you think, how it can cause damage to our body?
Smoking and drinking are both very bad habits. And smoking can not only damage our heart, it can also do harm to our lungs. It is also the most important factor for cancers.
Oh.
And smoking can make our arteries become hardening. So it is very necessary for the young people to quit smoking. And if you find someone around you smoking, you should stay away from them. Otherwise, you may suffer from second-hand smoking.
Oh, so we can also suffer from second-hand smoking.
Yeah, and drinking. You should not drink a lot. If you're drinking a lot or always stay drunk, you may have a high risk to suffer from chest pain. So you should reduce your drinking.
Okay, so you mean that smoking and drinking not only affect our heart,
Yeah.
but it also affect our lungs and liver and
Yeah.
other problems, right?
Yeah.
And it can cause lung cancer.
Yeah, yeah.
Wow, that is very dangerous.
Yeah.
Now, like for example, when someone suffers from the chest pain, right? And let's say he's not in the hospital.
Yeah.
He's outside the hospital, at home or at working place.
Yeah.
Now, when someone suffers from the chest pain, so how they can do for themselves, or the people around themselves, what they can do for them.
If you suffer from chest pain,
Okay.
you or people around you should seek emergency medical treatment immediately.
Okay.
It is unsafe for you to drive to the hospital. It can make your chest pain get worse, and you should get a ride or call an ambulance.
Okay.
If you find the people around you suffer from chest pain, you should help them to sit down or lie down to have a rest.
Okay.
Some people with long-term of heart problem may have medicine in their pockets, just like nitroglycerin. And you can help them to put one tablet under their tongues. Then this drug can reduce the chest pain.
Oh, so this is the special tablets to relieve the chest pain, right?
Yeah, yeah.
Oh.
And also you can help them to seek emergency medical treatments at once.
So you mean that someone, when they suffer from a chest pain, they should rest down, right?
Yeah.
They should not drive or they should not walk, right?
Yeah.
Okay. And should immediately rush to the hospital, right? To get
Yeah.
the medical emergency
Yeah, yeah.
treatment. Now, when someone suffers from the chest pain, and let's say he reached to your hospital, like Hunan Provincial People Hospital, what kind of facilities you can provide to the patients when he reached to your hospital?
Nowadays, an emergency chest pain center has been provided in our hospital, which is the only center in the whole Hunan province.
Okay.
And this center can manage automating, sorting, inspection, and routine medical treatment, and primary intervention. When you suffer from chest pain, an ECG will be given to you within 10 minutes at your arrival. And this kind of test can help the doctor to determine whether your heart muscle is damaged and what part of the muscle has been damaged.
So you mean that when the patient reaches to your hospital, you do the ECG and blood test, right? To confirm the diagnosis.
Yeah.
Okay, and after that, what do you do? What's the treatment plan in your hospital?
And if the ECG and blood sample can diagnose the patient as acute myocardial infarction, we would send the patient through green tunnel and to accept primary PCI immediately. We have a professional team, and then they can do very excellent procedures for the people who suffer from chest pain. At our center, we can save a lot of time. Time is life.
Yeah. So how much time it takes when the patient reaches to your hospital till the end of the procedure? How much time it takes in your hospital?
We just call it door to blue. Door means when the patients arrive at the door of our hospital. Blue means when we put the blue in the blockage arteries and open the arteries.
Okay.
We just control the whole time within 90 minutes.
Within 90 minutes?
Yeah, the shortest of the time is about 20 minutes.
20 minutes.
So we just try our best to save more lives, to save more heart muscles. Then the goal of our center is to reduce the mortality of the chest pain.
Okay.
Yeah.
Okay. Thank you very much, Dr. Francis.
Yeah.
Thank you very much.
Yeah.
Dear viewers, as you have seen that our respected guests have explained the disease in a big detail, I hope you must get some benefit out of it. Now, if you want to be healthy, please take care of your diet, and you have to quit the smoking and drinking. Now, if you have any question or suggestion, you can email us. See you next time with a new topic. Till then, take good care of yourself and the people around you. Stay tuned. Have a good day.